now, everyone is already quite well versed with how to, reduce and prevent this COVID-19. Cleaning your hands often with soap and with sanitizers, cleaning surfaces, especially those high touch rate surfaces like the handle of the escalator, elevator buttons, your handphone or sitting area. Yes, those places should be clean and sanitized if possible. Avoiding crowded places, especially enclosed crowded places for long duration of time. Avoid going to places that has positive cases contacts, especially in religious events when we just see Malaysia have 15,000 people congregating, and then the next day there's like thousands more people congregating in Penang, and then now we have thousands of people congregating in Kuching for some silat thing. I'm like, those are the things that you should really avoid, because again, you do not know, and those places are very cramped. If possible, discuss for a chance to work remotely, especially if you are in areas where the cases have been reported. If you can conduct your meetings via Skype or WhatsApp call or something, I think that should be encouraged. If your work is mainly computer based, where you can actually do it from home, discuss with your boss and do it from home and all these kind of things. It'll make much more sense, and avoid close contact with people who have close contact with everyone else. So those are steps to minimize risk. But if you do need to have meetings, have it short, quick, open up the windows, have a good ventilation, and make sure those who are sick are being isolated or are being excused or exempted from the meetings. And if you are sick and you have to go somewhere, please put on a mask. One of the best ways to actually help this condition is, number one, to self-declare. If you have been traveling recently to places or anything, you have to declare and make sure to everyone that you know of your risk and you're assessing yourself. So monitor out for symptoms, and if you have any symptoms, you have to go and get it checked with your nearest doctor right away. Some of you have been given the order to home quarantine, and different people take it to a different level of seriousness. And the term home quarantine means, one, you're supposed to have no visitors and no contacts, and to avoid going out and everything, because some people take home quarantine as like an excuse to not go to work, and they still go to the malls, they still go to gym, they still hang around outside with everyone else like normal, but not at work. Well, any crowded place is a risk. Whether you're going to a high risk area is high risk. If you're going to a low risk area, it's still a low risk. But there is still a risk because, one, you do not know the history of everyone around you. You do not know their contacts. So going into an airport which have a lot of crowd and people coming from all corners of the world, it is a risk. But when it comes to being in an airplane, is the risk still as high because it's a confined area? The answer is no. So the air is usually being circulated and filtered before going back into the cabin. So a lot of virus and bacteria actually gets filtered out before coming back into the circulation. So the airplane itself is quite safe. Another important thing to do is, when you're on a plane and you actually hear someone coughing, then it's good that you move away so that to be further away from the source. That will definitely help. Or if you have an extra mask, you can give it to them and force them to wear. So a lot of people actually ask like, should I wear a mask, or does mask help? The mask, however, the face mask is not recommended by WHO, is not recommended by CDC or anyone to be worn unless, one, you are actually sick. If you have cough or you're sneezing or your flu, you wear the mask. Why? Because any of your secretions, your cough, your sputum, everything will be trapped in the mask. So the chance of it, spreading around to the community is less. And two, you should only wear the mask if you are taking care of an ill patient. If you're taking care of someone who is ill, and you wear the mask so that the risk of those cough and secretions to land on your face is less because it's prevented by the mask. But when we talk about, can the mask actually filter away the virus? The answer is no. And I'm talking about what 99% of you guys are using, which is that face mask or that surgical mask, that blue thing with a little piece of metal here and some ear loops. That does not give you a perfect seal. And two, that mask is not made to filter away particles as small as a virus. So if there is a real source of COVID-19 and you are wearing a face mask and it is being transmitted to you, that mask cannot prevent the disease for you. However, if you are using a proper medical grade N95, which is a full-on face mask which has a complete seal, that will actually prevent all particles from going in. But that is very uncomfortable, it's a bit more expensive, and it's not so easy. Vitamin C helps with our immunity, and basically someone with a stronger immunity can defend themselves against all kind of infection, viral infection, so including the COVID-19. But if you have a normal diet where you eat fruits, you eat vegetables, you eat all normal food, then it should be sufficient. But in case you need supplements, everything else surrounding outside is on mega doses, means about 100 times the dose that you're supposed to get, from 500 grams. It doesn't prevent you from getting infected. It just gives you a little chance that when you get infected, the outcome is better. Yes, and vitamin C is one of those vitamins that help with that. A lot of people ask what's the dosage. I think 500 milligrams or 1000 milligrams. So it's at your own discretion which one you want to get, because the clinical trials don't show any difference by taking these extremely high doses of vitamin C. For right now, I don't think Malaysians need to panic yet, because most of the cases are actually cluster. It means that someone has the disease and they went into a big crowded area, and that's where they spread the thing. If you abide by all the precautions, which is to avoid crowded areas, to avoid all those meetings and events with a lot of people crowded in one small area, that is one of the best ways to prevent, because the transmission of the COVID-19 is not as aggressive. It is not like I cough one time, everybody in the room will get. But if you put yourself in the position where you're exposed to possible people, then your risk of contracting the disease is very high. I do think people need to prepare for the worst, as our cases are climbing up in quite an exponential curve. I believe it is going to be even higher, possibly in the thousands within the next week. So there will be a lot of new travel bans that's going to happen, a lot of bans against meeting more than a certain number of people. This is all to cut down. So exercise precaution, take care of your health, avoid crowded areas. I think those would definitely be the best advice that I can give. People who die from COVID-19 are usually of the extremes of age. Usually those above 70, above 60, they have a higher chance to succumb to the disease, especially those that have pre-existing medical conditions like hypertension or lung disease or heart problems. Those are the people who usually die from COVID-19. So for the younger generation with a stronger immunity and no pre-existing medical condition, their survival rate is much higher. However, I do need to stress one thing. This disease is very young, it's only 2 months old, and the death rate is quite high. And there's still a lot of things we do not know or understand about the disease, because there are case reports saying that those that survive have permanent lung damage with reduced lung capacity. And we will only know further down the line what are the effects on the population.